There you go.
It might be worth noting, unless you already said that, I mean, these medications among the antidepressants are about the safest in an overdose situation. They're many of the antidepressants are actually not safe to overdose on, you might say, but of course people with depression can be suicidal, right? So these are the safest class of antidepressants for patients who are suicidal. Bowen, I think it's true that they're really the only class recommended for younger, for like teens and transitional age youth. You're going to go through that, and the elderly as well for safety reasons. So this is the safest class.
Yeah, there's a whole slide on side effects, but the other thing about this SSRIs while we're here, everybody's heard about the black box warning for kids for under age 18. Some people don't know who it applies to. Now it also, this is a talk about adults, but what they've noticed is that for adults between the ages of 18 and 24 or 25 roughly, that it seems there's what they call a signal where it seems to increase risk of, not risk of suicide, but increase suicidal thinking. So if you compare a group of young adults who take medication versus a group of young adults who take a sugar pill, people who are in the group that take the SSRI have an increased risk of suicidal thinking. In the group that gets the medication, it's approximately 4%. In the group that gets the placebo or the sugar pill, it's about 2%. It does double the risk. What they have shown, there's never been any completed suicides in any what they call observed situations, meaning in studies. And there is a lot of secondary evidence to suggest that it does actually decreases actual completed suicides, although studies are still ongoing. So you might want to hear about that. It's a big deal actually because the FDA issued a black box warning, which is the strongest warning they put on a medication before they pull it off the market. It was such a big controversy.
So the other thing I just wanted to mention was also about the elderly, because that was an issue that was raised. So usually for starting doses, we are usually starting at lower doses than we would generally for adults. And that's partly because of the physiology of older individuals in terms of how they respond to these medications initially and the side effects. The other thing is that, again, many of our older patients are on multiple medications, and there definitely are going to be some interactions in terms of how these medications may affect other ones. And so for that reason, when I generally have been treating older adults, I usually will start with citalopram because, again, it tends to interact less with most of the other medications, but we often find that we need to switch the medications, and we'll try another one and see how that works for them. But usually that's the first choice that I would select. And then the other thing on top of that is that, again, it's generic. So, in terms of these $4, per month formulary medications that you can get at most of the major national chains, Celexa or citalopram is one of them. So again, for those older individuals who don't have a lot of money, if they're just, only getting Social Security or, if even that, given the kinds of populations we work with in Los Angeles, this is certainly a reasonable thing to start our patients off of. So in terms of the newer antidepressants, I'm not sure how much we really want to go through this, but again, there are these other medications that, again, if people are not responding to the SSRIs, there are these other ones that are out there. Many of them are not generic, so these are going to be more expensive for patients. And if you're working with some of our safety net clinics, these are not going to be on the formularies, so they're probably ones that you will not see as often among your clients or patients. Yeah, except for Effexor, because I think, but we'll talk a little bit about it. But anyways, so these are similar. These are, they also act sort of through the same type of pathways that the SSRIs work through, except that they're also acting through some of the noradrenergic systems. So these are SNRIs. And so you'll see that for venlafaxine, there are different sort of formulations for this. There is, one that's not an extended release, so it's given much more frequently. So it's given twice a day. Again, for having people remember to take the medications, that's not so easy all the time. So there is an extended release form that we often will give on a daily dosing regimen. And so you can sort of see here that this is the therapeutic dose. But again, we always generally start patients on lower doses initially. in terms of where they begin. So if this is sort of the therapeutic range between 12.5 to 150, we're usually starting people off on 25 a day. And that's twice a day, right? So if you think about it, we're usually starting on a much lower dose. And the usual dose will be somewhere around here, but again, we know that people have varying responses. So as I mentioned, there's this once daily dosing regimen. Again, some of the common side effects that we'll see here, again, are just like the same ones that we see with the SSRIs. So you'll see nausea, agitation, or insomnia. We also know that at higher doses, sometimes this will affect patients' blood pressures. So for those patients who have problems with blood pressure or other sort of cardiac problems, we tend not to use this medication. Duloxetine or Cymbalta is a very new medication. This one is not generic. Part of the reason why you might see patients on it is because there's an indication for using this with patients who have chronic pain. So this was the main thing that got this drug approved on. So for those patients who have chronic pain syndromes, you'll often see doctors using this medication. Again, it's very similar to the other SSRIs. So again, in terms of sort of the dosing ranges, it's not as unusual as, let's say, venlafaxine or Zoloft. And so you'll see that usually for the therapeutic range, it's around 40 to 60 milligrams a day, and that's usually what the usual doses will be too. And usually we will start people off on, let's say, 30 milligrams a day. In terms of side effects, these are usually going to be, again, just like what we've seen before: nausea, dry mouth, constipation, sometimes decreased appetite and fatigue, sexual dysfunction, and sweating. The one thing is that this is not a medication that you can break. Some of the other ones are actually scored so that you can break them, and again, that sometimes is going to be even more helpful for patients who have financial problems so that they can extend their medications longer. But this is one that wouldn't work. Some other newer medications, bupropion or Wellbutrin. Again, this is also available as generic. So this is a medication that you might also see other patients on if they were smoking. Many of our patients often are smokers, and this is one that is used to help with smoking cessation. So you can see that in terms of the frequency of dosing, it's a little bit more frequent. In terms of the usual range, in terms of treating patients, sometimes we can get away with the once daily dosing with the sustained release preparation, or we might need to go to twice daily dosing. If we were using the original type of medication, we kind of have to go to either twice daily or 3 times a day dosing for this. In terms of typical side effects, this one tends to be one where people tend to have a little bit more of the insomnia and agitation problems. And there also is a risk of seizures at high doses. So particularly for those patients who have had a history of seizures, which we often will see when we're working with populations that may either have seizures because of some underlying seizure disorder or had a history of a seizure because they were withdrawing from alcohol, if they're using other substances. This is a medication that you wouldn't want to use. The one thing about it is that oftentimes when patients are having sexual dysfunction, this is the medication that we will often switch patients to because we know that there are minimal side effects with that. And then finally, Remeron. Again, this is one that's not generic yet, but it also has minimal sexual side effects. So this is one that we will often try patients on as well. But because it's not generic, I'm not sure that this is one that we will see with this population. But again, in terms of dosing, we tend to use the usual dose of 15 to 30 milligrams a day. The therapeutic dose is 15 to 45 milligrams, and usually we start at a lower dose at 7.5.